Okay, thank you very much for having me.
Yes,
I apologize
yes.
for the delay. I'll be quick. What I want to share with you today is a molecule that we've been developing for the treatment of snakebite with Dr. Stephen Samuel, who is a resident, a native of Tamil Nadu. We've been working on this molecule for about 7 years for the purpose of having an oral antidote to snakebite that anybody could carry with them anywhere as needed. What I'm finding is not able to advance.
Yes.
Yes, Matthew, are you feeling?
Let me show you this. This is what this drug can do. So this animal has been paralyzed by the Mojave rattlesnake venom more than 3 hours earlier. It's been envenomed and now it is deeply paralyzed. And for those of you who've treated snake bites, you know that it's very difficult to reverse paralysis. So it'd be very nice to have a drug that doesn't care what type of snake it is. And you can see this animal is becoming progressively weaker. This is a neurotoxic snake from North America. And in this particular study, we're just giving a 1 milligram per kilogram bolus of the drug. And within minutes, the animal will just get up and actually be quite normal. And so the attributes of a drug that you would like to have in the absence of anti-venom or in conjunction with anti-venom is something that's easy to use, has a broad spectrum, and you don't care what type of snake it was. And so this is what we've been aiming for. And in this particular experiment, we're using an IV version of the drug, but it's a small molecule and can be formulated either as an IV or oral drug. What is nice about this drug is it has a lot of clinical experience behind it. It was actually developed by Eli Lilly about 20 years ago. It's been tested in about 4,000 patients for non-snakebite indications, but it lacked efficacy for conditions such as rheumatoid arthritis and severe sepsis. Because snake venom uses PLA2 quite broadly, snakes use PLA2 quite broadly as a weapon for both direct toxicity and to regulate metalloprotease activity. We thought this was an appealing target for development for this purpose. Sorry, my circle is a little off target here. What you can see here is an in vitro study. We did dose response curves, and you can see that Varespladib's inhibitory concentration is 4 to 5 orders of magnitude greater than for any of the anti-venoms tested. And we have recently demonstrated with Dr. Stephen Samuel and Dr. Shakti Vaipuri. I just mentioned Dr. Samuel is on this call and can also answer questions. That this drug is actually synergistic with anti-venom, which is a quite interesting finding. Most notably here, Varespladib, you can see subnanomolar IC50s compared to anti-venoms, which tend to sit in the micromolar range. We've tested more than 45 snake venoms from around the world for PLA2 inhibition, and you can see the geographic range and the many different snakes, some of which will be familiar to you, or many which will be familiar to you from the cobras, kraits, and Russell viper, with these nice IC50s. And we've recently published a paper in scientific reports proving the mechanism, which is that the small molecule Varespladib directly inhibits the highly conserved PLA2 active sites. And we've published this for both the enzymatic and non-enzymatic isoforms of snake venom PLA2. We've had a paper come out last week in BBA further describing these mechanisms for the different quaternary structures of the different venoms, such as the dimeric PLA2 of krait or the monomeric of Russell viper. I'll show you an oral study that we performed a few months ago. On the left-hand side are mice treated, dosed with lethal doses of venom. Up top, Indian polyvalent anti-venom kindly provided by Premium Serums, and our oral drug all by itself. On the bottom, similarly up top, a North American anti-venom and the oral drug. And you can see that the mice in the orally treated group are quite vibrant, and the anti-venom mice are a little bit moribund. I'm going to play this one more time just so you can orient yourselves again. The bottom group, those are orally treated alone. There's no other treatment, just the drug. They're doing quite well. The result of this study is just summarized here in this particular slide on the top right, the Mojave rattlesnake, which is one of our local rattlesnakes in California. The Varespladib mice did quite well, and the anti-venom mice and the control mice soon died. Similarly for the Russell viper. This is a quick sampling of studies we've done with other venoms from around the world: saw-scale viper, Russell viper, taipan, South American rattlesnake, European viper. You can see that the drug, just by phospholipases, does a quite good job resulting in survival. What's interesting is that even with the saw-scale viper, the animals will still bleed, but they will all live. So what are the next steps for this strategy of combining the small molecule approach with anti-venom? We have now gotten funding to perform a phase 2, which is taking place in both India and the United States. We're quite excited about this. We plan to conduct a study in Chandigarh, Rajasthan, Tamil Nadu, and West Bengal, spanning from the West Coast to the East Coast as well. We received our IND this month, so we can proceed with the study. We have the DCGI submission pending, and we're hoping for an accelerated review. We don't know if that's possible with the current conditions in India, but in theory, we could start this study this summer, enroll the first patients in India. The basic design is a phase 2 randomized, double-blinded, placebo-controlled study. Multi-center, as you saw, about 2/3 of the patients would be recruited from India and 1/3 from the United States, where recruitment is quite difficult. We do not have a lot of bites here, perhaps 11,000 a year, spread out over the entire country. So recruitment will be a little more challenging in the United States. And of course, the primary objective is to demonstrate that this drug will improve outcomes, especially for neurotoxic envenomings. Just want to show you what the oral drug can do. This is a neurotoxic snake. This is a coral snake, which is a very close cousin of the crate, which is the small nocturnal elapid that you have in throughout India. For those of you who've worked with pigs, they're incredibly strong animals. This animal is getting an oral gastric tube with the drug, can't even resist. But as you'll see, he'll be up on his feet in a very short period of time. And so it would be very nice, as we imagine, that if you had patients who would otherwise be on a ventilator, could be off in a matter of hours. The patients that we see with this envenoming will often be on life support for 10 or 12 days before they wean off. But you can see within 12 hours that the animal is playing. Oops. So I hope to get you some of your time back. Of course, we're delighted to be invited to give this presentation. There are other small molecules that have been considered. Dr. Nick Casewell of Liverpool School of Tropical Medicine has been publishing some magnificent papers on drug combinations. And it would be very nice to develop a low-cost antidote that could supplement anti-venom therapy. And I think I will stop here and answer any questions if they're available, or give you your time back.